Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. And today I wanted to talk something really important, the need of the hour, because cesarean sections are increasing and the trend is increasing. So is the risk of obesity, so is the risk of diabetes, so is the risk of complications in say adult population. It is not only about pregnancy and childbirth, it is overall increase in the chances of morbidity. We call it as morbidity because uh, obesity is a pandemic now, and we are dealing with this pandemic in terms of very difficult terms. Every department of medicine is affected. Even if you think about skin, even if you think about hair, even if you think about eye, even if you think about dental, there is no department, leave alone medicine, surgery, obstetrics, gynec. There are none of the departments are left over because of this pandemic. And uh, we have to understand that obesity is now a life choice, and whatever that we can do to fight against this pandemic, we should definitely do, because it is our choice of living. It is in our hands, and our lifestyle is what is the major cause of this problem. Now, if we have to talk about the lifestyle problem and the choices that we've taken, it is important to know that obesity not only impacts your overall health, it also impacts the future that you have. And in this context, I always suggest somebody who is obese to definitely lose weight before planning pregnancy. And the best part is if teenagers are motivated and if parents are motivated to mobilize their children early in childhood, inculcate good practices in their life in terms of activity, in terms of eating right, in terms of sleeping right, in terms of body discipline. Definitely, we'll have a long way to go and it'll impact their health. It is not about giving training in schools that give training as if they are teaching some hen in cages. It is absolutely not correct. It is the freedom that you should give to your mind, body and soul to grow. And it is not about forcing education. It is not about always thinking about education and not thinking about physical form and physical support and physical health. So it's a long way to go. And I wanted to talk today about obesity, pregnancy, labor and childbirth. So this is the need of the hour. Why are we facing difficulties? Why is the problem coming up in obstetrics? What is happening in pregnant women? This is a very sensitive issue, and I definitely feel that if a pregnant woman takes a choice of eating right and maintaining her health, sugar levels, blood pressure levels, and everything during pregnancy, and goes towards a lot of discipline in pregnancy, the next generation is going to be very healthy in terms of avoiding childhood obesity, in terms of avoiding hypertension and diabetes in their early lives. So there is maternal programming that is happening inside the mother. So whenever possible, whenever situations are there, you should improve the health of teenagers and young population and make them aware of the obesity and its problems, and make sure that their body mass index falls in the normal range, so that when they are planning pregnancy, they will obviously not have complications. And that is one message today that I want to give you is anybody contemplating to have pregnancy, definitely they have to lose weight. And there are countries where they don't give any kind of a fertility treatment if you are above 30 BMI. And India, definitely people have a lot of choices. People have say money power. They can overpower any decision of the doctor and change the doctor if the doctor is not working according to their norms and conditions. So there are people who do even fertility treatments for 40 BMIs and 45 BMIs. But what ultimately happens after you give the pregnancy to the woman and she lands up in an obstetric unit? Imagine the plight of the obstetricians and the unit there who have to take care of such a high risk pregnancy. And yes, obesity has lot of implications on the pregnant mother and on the baby also. In the pregnant mother, if the mother is obese, there are increased chances of BP in pregnancy, increased chances of diabetes in pregnancy, increased chances of having toxicity in pregnancy, that is the preeclampsia, that is the hypertension of pregnancy. And the complications of that hypertension can be seizures in pregnancy, can be liver failure in pregnancy, can be diabetes, a separate entity called diabetes in pregnancy, which can be more in obese women. And they already have a lot of problems because of obesity, like sleeping issues and breathing issues, and they have mobilizing issues. So there is a complex problem revolving around obesity. So mothers as such can have so many problems, and especially when they go through fertility treatments and assisted reproductions, they can have twins, they can have complications related to twins, they can have complications related to the high risk pregnancy per se. And what implications do the obesity have on the baby? Yes, obese women can have little more of birth defects in the babies. They have you know difficulties in doing ultrasound also. When we do ultrasound also, the maternal fat is an obstruction to look at the baby perfectly. So there is less penetration of ultrasound. So we cannot detect all the problems on an easy basis. So there are chances of missing problems also. And the chances of bigger babies can be there. The chances of smaller babies can be there, associated with the hypertension and diabetes. The chances of preterm birth will be there in the babies. The chances of unknown stillbirths are also there. And especially the implications of BP and diabetes on that baby are also there. So it is very much ideal, and the message goes very clear, that it is ideal to lose weight before pregnancy. You choose diet, you choose exercise, you choose lifestyle management, you choose anything. And when you talk about BMIs, okay, body mass index, you can have the calculating formula online also. If you are falling under the BMI of 25 to say 29, you're overweight, and that is the right time that lifestyle changes can give you some kind of a weight loss, especially diet, exercise, discipline, sleep, decreasing your stress and all that. And if you are in the body mass index of 30 to 40, you are obese, and you have to resort to some kind of a help from other departments to lose weight. For example, bariatric surgery, and a different kind of bariatric surgeries are available, and different type of medical bariatrics are also available. And you need some kind of an extra motivation and professional help if you're not choosing bariatric. To lose weight, you need a lot of other integrated help of physiotherapy department, diet department, and rehab department and all that. So there are instances where we have figured out that they might need professional help from psychologists also and psychiatrists also, because obesity is a complex problem, and where you have to start correction is very, very important. And it is very important that you are in sync with whatever that really weight loss matters for a healthy pregnancy. And there are people who are more than 40 BMI, that is called morbid obese, and there are people who are more than 45 to 50 BMI, that is called super obese. So in such conditions, definitely pregnancy is very dangerous, and you have to keep track of what is happening in you. It is not about having a child, but what is about your future. So if your future is not good with having a child, and you're pushing yourself that extra mile and pushing yourself for that extra risk, then you should think about it. And whenever possible, wherever possible, you have to lose weight before planning pregnancy is still what I say. And I am the only person in India who has done deliveries for post bariatric surgery women. I have done about 68 women who have already had bariatric surgery and they delivered with me, and life after bariatric surgery was absolutely smooth for them. And in fact, they took a break of say approximately 1 to 2 years after the bariatric surgery to get back to normal and then planned pregnancy. Eventually they had very good pregnancy outcomes, and than the ones who were still obese and delivered. So in terms of comparison of outcomes, I can tell you how good the outcomes were when you finished your bariatric surgery, gave a gap of say 18 months to 2 years, and then planned pregnancy. So it is not possible with everybody, and it all depends on your motivation. If you're highly motivated and highly conscious, you can do weight loss even with diet, exercise, and lifestyle modification also. And pathologically high BMIs, like more than 45, more than 50 BMIs, definitely need a composite help from different departments. And now still, if we see, obese women need a careful management, attention to diet, exercise, antenatal care, monitoring of pregnancy, and identification of complications very, very closely. You just can't land up in some clinics, and you can't land up in some normal hospitals where there are no supportive measures to take care of obese women, and you just can't land into places where you have a complication and then you run to different corners of the city to figure out where you can have a solution for it. Always make sure that whenever you have a risk factor, you should book under people who can take care of your personal situation that you are in. And it is very important for the pregnant mother and the immediate family members or friends or everybody to understand, and everybody who's listening here to understand that pregnancy needs only 300 calories per day extra. So that comes with if you have to say that around 4 idlis can give that 300 calories extra, or one glass of a proper milk with some kind of a protein powder or some kind of nuts and all added to it gives 300 calories. So it is not about engaging in eating and gorging food because you're pregnant. Absolutely not necessary. And for somebody who's obese, should not gain 15-20 kgs in pregnancy. For that, 15-20 kgs has been coming over since ages as a practice to gain, because women used to get pregnant before 20 years and they also had very low BMIs. Maybe in if you take 20-30 years back, if you would have seen that women were less than 20 years when they got pregnant first, second, third time or whatever, and their weight was somewhere between 35 to 40 or 45 kgs, not beyond that. And now that when women are getting pregnant at 25, 30, 35 and they're already 65, 70, 75 kgs of weight, you do not expect them to gain so much. You always restrict their weight gain, you always restrict their calorie intake, and you always restrict their amount of unnecessary food that they are eating. But under the influence of past generations who have had better food, and they did not have choice, and now that we have abundance and we have choices and we have food from all over the world available on our plate, they want to give us something more than what they could not get in their pregnancy. And they want to give us that worldly bed rest, the worldly care, and the worldly good things that are available all around the world to that pregnant woman in whatever social economic status they are. If they are poor, they give whatever they can. If they are rich, they give everything to her. But they should understand that anything that is given unwanted or unwarranted will give problems. And it is important for anybody who is obese, who wants to have a child. Definitely exercise is one mode of you to keep fit, and your muscle is also having lots of fat deposits, and you have to make sure that the muscle contracts very well and you're physically fit and healthy, and somewhat try to reduce the fat cells inside your muscles by putting them into action. So exercise like walking or yoga or swimming that can give you that kind of a fitness and activity to your muscles, so that they take care of your body and do not put pressure on your bones, is very, very important. And in pregnancy, it is really important that you have to be physically fit to have good outcomes in pregnancy. And I have had so many pregnant women who have got motivated their entire pregnancy, did whatever said and done, and they have delivered normally. I do not say that all obese women will land up into cesareans. Absolutely not. It is how motivated you are, how you're giving your body that directions and willpower, and how you're trying to train your brain and body to be in sync with your decisions. If your decision is to have a normal natural childbirth, even with 40 BMI, you will have a normal childbirth because you are motivated. That is more important. And your doctor should always motivate your motivation. And if your motivation is wrong, your doctor should try to change your motivation into something that will really suit your body. And currently, if you are not having any complications, say if you don't have a preterm delivery, or if you don't have a severe hypertension running in your body, if you don't have diabetes and a restricted baby, or if you don't have diabetes and a very big baby of 4.5 kgs, so if the situation is not going towards a cesarean, you should make an effort in every given point of time that you do not land in a situation which is going towards an operative delivery. So entire pregnancy, you have to take care about your diet, exercise, sleep pattern and stress pattern, and eat right, eat local, eat seasonal, live sustainably. And sustainability angle will definitely give you a lot more of positiveness. And we have done sessions on diet, we have done sessions on superfoods, we have done sessions on how to improve maternal diet. So all these things have a very good impact on giving you the normal delivery outcomes and normal delivery normal delivery targets that if you have. And if somebody is been fed information that if you are obese you'll have a section, if you are obese you'll have a section, absolutely not. That is international statistics of non-motivated women. That is the international statistics, what predictions people have given in their studies. And you cannot influence somebody with some study. Influence women who are capable of getting influenced in the positive way. So definitely there are studies that say that increased risk of cesarean is there, increased risk of anesthesia is the risk is there in obese women, increased risk of infection, increased risk of bleeding. Then why do a cesarean? I say, then why do a cesarean? If there is no option and the life of the mother and child are at risk, definitely then there is no choice. But you should not land into such a situation is what I say. And there is documented evidence that labors are longer in obese women. It is difficult to monitor baby heartbeat in obese women. There can be traumatic deliveries, there can be instrumental deliveries, there can be dystocias difficulty in delivery. Even the fat tissue can cause little bit of difficulties in delivery. Even after delivery of the head, the shoulder can get trapped if it is a big baby. So all these things are there, but nothing is politically incorrect. You just are being judgmental about things. So it is how your antenatal care program takes them through the journey of pregnancy with obesity. It is how the doctor motivates the woman towards having a natural vaginal delivery. So it is all about your thought process. It is all about influencing pregnant women who are obese in the right way. And whatever BMIs can be, there is that everything falls down in the determination of a perfect, strong woman who's pregnant and wants to do a normal vaginal delivery. And there are shoulder dystocias, and the cesarean rates are there, malpositions are there, infection chances are there, preterm chances are there, long labor chances are there. But labor dystocia, I tell you, it is multifunctional phenomena. There is more of a fear component, there is more of an influence component in it. And whenever motivation is there, right antenatal care, right antenatal classes, right partner support, right family support, right eating patterns, right exercise patterns, and follow up good glycemic control, that is a sugar control, good blood pressure control is there, definitely you have a very good chance of a normal vaginal delivery. That is for sure. And that is how I make a lot of difference in pregnant women's life who are obese, and I make sure that they have a normal vaginal delivery, because you have to boost their subconscious, and whenever the subconscious is influenced, definitely the chances of normal vaginal delivery are there, whatsoever it is, whatever BMI is there. First and foremost thing is you should be motivated. Second and important thing is your metabolic parameters should be under control and guarded. Third thing is you have to give them absolute good antenatal care, a 360-degree care, in such a way that tomorrow, if for any foreseen circumstances, they should be physically fit, mentally fit. And labor is definitely about, it's about multifunctionality, and there are, other than the physical powers that the woman needs, there are so many other powers that she needs during labor and delivery to support the labor process. So this is all about obesity plus labor and childbirth. And for me, nothing is impossible. That's very important. And that message goes very clear that you have to put everything that you have when you want something really good to happen. And for some, something good like a normal vaginal delivery to happen, obesity is just a hurdle, and you can just cross it and go and have your normal vaginal delivery absolutely safely. Just the matter of fact that you have to be motivated, well controlled, and you should have a doctor to guide you. And it's the doctor's responsibility to increase the level of confidence in the pregnant women who are obese and who want to have a normal vaginal delivery. Entire team should be supportive. If there is any complication, the hospital should be supportive. And it is very important that we encourage normal vaginal deliveries in such subset of population, because even with a surgery, they have a lot of complications. So why not encourage vaginal delivery? Why not motivate them for a vaginal delivery? And it is done throughout antenatal care. It doesn't happen overnight. Your entire antenatal care is screwed up, and you come and ask me to give you a chance of a vaginal delivery. I might give you a chance of vaginal delivery, but it would be entirely a different aspect when the antenatal care program goes through smoothly. And there are people who have just landed with 35 or 40 BMIs, and they wanted to have a normal vaginal delivery. Nothing goes in front of a determined woman. So that is what I believe. And I always tell them that, yes, I will give you a chance, because your determination is the positiveness that shows me that you can have a normal vaginal delivery. So this is all about obesity, pregnancy and labor and childbirth. Childbirth is a normal phenomena, and we have to go towards that normal phenomena in every given point of our life. So let's make childbirth safe. Let's make childbirth happy. Let's make childbirth safe for every category of women, and antenatal care accordingly to increase the safety of the delivery. So this is all about obesity, pregnancy, labor, childbirth for overweight and obese women. You are God blessed, and definitely your chances of having a normal vaginal delivery is great. Just keep motivated and just keep up with your lifestyle. That's it. So yet another topic tomorrow morning. And so there were so many people watching. Thank you all for watching. I'll figure out another very interesting topic for tomorrow. If anybody wants any topic, I will definitely talk about that topic, and we can discuss those topics. It can be interactive, and just put in a message at what topic you want me to talk on. I will talk and make sure that we will have an interactive session. So it's all about natural birthing and normal delivery, and keeping up to the trend of increasing normal deliveries. Bye bye.